something. So that's the first class of arguments, is comparing across random variables. And the answer, you have to train people to tell them it is a multiplicative process. And multiplicative processes are not to be compared with static ones. They're riskier. They have what we call fatter tails. And we showed in the classification of fat tails, it means event that can bring extremes, pandemics come first. Pandemics, wars, way above all other classes of phenomena. So that's the first class of argument. And now there's no point making it, because between 5 and 15 million people have died of COVID, if we count right. So the lower bound is 5 million, official number, and 15 million is the total thing. And if we have, people still arguing that car accidents are to worry about, the numbers exposed have removed that. But there's a more vicious class of arguments, and it's as follows. I remember someone said he cannot hear. Can you hear me now?
Yeah, we can hear you.
You can hear me. Okay.
I don't know what is happening.
Okay, all right. There's a second class of arguments, and these are vastly more vicious. I remember one day a certain representative of a certain trend within a certain party, said, "Oh, it's a big impingement on liberty it's a big impingement on liberty to stop people boarding planes. Look, we don't have terrorist events, so why are you checking people before they board the plane?" You see the absurdity of the point. And that's precisely because we're checking people that we have no result. And these classes of arguments are vastly more vicious. I already wrote in the Black Swan that someone who prevents big random events typically gets punished, because you see the input, you don't see the absence of output. Our society has reacted against COVID. Right? People say, "Oh, look, COVID didn't kill more people, didn't cause a turmoil." I say, listen, it's the overreaction that protected us from further catastrophes. It's the overreaction that prevented people who otherwise wouldn't be able to reach a hospital, and prevented them from dying. So that second class of arguments is very vicious, and I would suggest engaging people along these arguments by telling them, listen, it's not we say because there was no war that we should eliminate the Defense Department. But by the same argument, I may say, I agree with you, let's ignore COVID because it wasn't as bad. So therefore, let's remove all seat belts because not many people are dying on the roads. Let's close all hospitals because we have periods where nobody's dying, and stuff like that. So, and that second argument is very vicious, particularly when it comes to economics. As Yanir keeps showing, the countries that overreacted early to COVID are the countries that fare the best, namely China.
Actually,
it is the cheapest
place, if I might.
So there is an inseparability.
Nassim, that's actually a really good place. Yeah, can you hear me? That's actually a really good place, because our next speaker is Cecile, who will talk exactly about that. Great. So if you don't mind, let's continue the conversation with Cecile, because it's time to switch to her. And go ahead, Cecile, and maybe Nassim, you'll have a comment afterwards. Is that okay?
Yes, thanks. Thanks a lot. I'm going to try to share my screen, but I have to say first that I'm very honored to speak after Nassim, because it's because of you, Nassim, that I looked at what was going on with the pandemics, etc., and that then I got in touch with Yanir, and we started to work on the economics. And so I'm trying to share this here. Do you see it? I can't hear anyone, so I don't know if you can see it.
Yes, it is up.
Okay,
it is up.
perfect. Let me see. Okay, So what we have been doing is that, are you still seeing it? Right? Okay. Okay. So what we have been doing is that we have analyzed the value of COVID strategies, and the data show really the lasting value of the elimination strategy in the fight against the pandemic. What we did is that we compared the G10 countries that have opted for a mitigation strategy with 3 OECD countries that have applied the elimination strategy. And they are Australia and New Zealand, and a similar strategy, South Korea. And what we have been able to show is that this strategy, the elimination strategy, has produced the best results, challenging the widespread notion that it was necessary to choose between preserving public health, the economy, or freedoms. It's far from being the truth. It's exactly the contrary, and these goals are complementary and aligned. The G10 countries have been hit much harder by the pandemic than the countries that have chosen elimination, representing around 82 million people in economically advanced democracy, because we wanted to compare ourselves to democracies we are very similar to us. And so what we see is that the number of deaths per million inhabitants was 44 times higher in the G10 countries, which means 1.1 million too many deaths by June 30, 2021. What we also see is that in 2020, the countries applying elimination had almost returned to normal economic activity. The GDP was down only slightly, minus 1.6% compared to 2019. Meanwhile, the decline in GDP was much greater in G10 countries, minus 5%. And it is a cost-effective economic investment, which has lasting positive effects, because in the second quarter of 2021, that's the last number we have, the GDP of the zero COVID countries grew compared to the fourth quarter of 2019. It's plus 1.7%. And in the country that did not eradicate the virus, GDP decline remained much significant compared to the fourth quarter of 2019, minus 1%. So it happened that in the second quarter of 2021, none of the G10 countries had recovered their pre-crisis quarterly GDP level, with the exception of the United States, while Australia, New Zealand, and South Korea had done so. But it's not only that. It's also that elimination costs less in terms of civil liberties.
It's not only that.
The analysis of the stringency index indicates that the OECD countries applying elimination have had a restriction level 4 points lower than the G10 countries over the last year and a half, 52 versus 56. So you can see those in those graphs. So all in all, actually, the elimination strategy, as people know, is that overreacting proved to be better for economics, for health, and for liberties. And it's for economists, it should have been obvious that actually, when you have control over uncertainty, actually you can have better social lives, and so have better interactions with people, and your economy is in a better shape. Here we are. I'm done.
Okay. Are you set, Cecile? I had to call Eric because he got lost. So are you all set? Good. So next is Michael to talk about elimination, progressive elimination. Please go ahead. You can share your screen when you're ready.
Well, kia ora, everyone from New Zealand. Thank you, Yania, for the introduction. And I'm going to pick up on some of the themes that Cecile has already introduced. This is talking about progressive elimination. Is it feasible and desirable? So just quickly talking about pandemic strategies, New Zealand's experience with elimination, the strategic choices we all face, and I think this critical need for global leadership and health equity. So this is a typology of pandemic strategies that we published in the British Medical Journal last year. Every country in the world is somewhere on this spectrum, with the extreme being exclusion, and this is still being practiced by some Pacific islands, and elimination. So here the goal is that you emerge into this carefully managed new normal, which a lot of countries have done successfully. The rest of the world is really largely in mitigation or suppression approaches. So with elimination, you have these key elements of excluding cases at the borders, rapid outbreak management, testing, contact tracing, preventing community transmission. And in year 2, we've obviously got effective vaccines, which help with elimination, and the need to support vulnerable groups. So what is the impact in New Zealand? Well, we started applied the elimination strategy very early in the pandemic, and it resulted in a rapid elimination of the virus in New Zealand. And after 7 weeks, we emerged into a virus-free country, which we largely sustained for the following 18 months. So the net impact of this, as we've already heard, is you have markedly less mortality from COVID-19 if you eliminate transmission, compared with these are countries in Europe which largely followed a suppression or mitigation approach. And this is an order of a 400-fold less mortality. So as we've heard from Cecile, there was much better economic performance in countries pursuing elimination. This was New Zealand's experience, where we had a net positive growth over this period. One of the challenges is, of course, with sustaining elimination, and this is showing the epidemic curve in New Zealand, where most cases were in MIQ facilities, but what we had recently in the last 2 months, we've had a Delta variant outbreak, which has proven very hard to control. This is just showing that some of the border failures we had from our MIQ system, that's managed isolation and quarantine, which is what people went through when they were coming into the country, that worked very well for most of this period. So this recent outbreak, we applied our usual approach of having a short, sharp lockdown to eliminate the virus. It was largely successful, except that the virus then became entrenched in marginalized groups. And after that, at a certain point, the government decided that we needed to basically rejoin the rest of the world, and so switch to what we call a tight suppression approach. I mean, many scientists in New Zealand were objected to this change, but the government felt for various reasons that it had no choice, partly because the virus was not being contained in our neighboring countries. And this virus actually was imported from Australia, which was transitioning from elimination to also to a suppression approach. So the world really has these two choices. You can either control an infection, and that's finishing up with endemic disease, and potentially a suppression approach to varying degrees, vaccination or elimination here. So elimination has been sustained in many countries in the Asia Pacific region, but they are now starting to transition to endemic infection in several cases. So you have these choices here with endemic infection of basically hoping the virus may become endemic mild infection. That looks unlikely. We're looking to have endemic severe infection is the most likely scenario, and with escape variants of concern. So the two big choices here when thinking about this decision is the feasibility of elimination and the desirability. Now, it's currently challenging to sustain elimination, particularly if you are doing this on your own, as opposed to all the neighboring countries also achieving this. But it is a very established approach for diseases like measles and polio.
I'm in the room now.
And easier with global leadership and a real focus on health equity. The desirability, again, this is one of the great debates. I think there are strong arguments around the benefits exceeding the costs, particularly given the impact of long COVID. And that would really shift the balance very much in favor of an elimination strategy. So we do need more information. So Our gaps at the moment, I think, there's critical need for global health leadership. There was a report, Make It the Last Pandemic, which I think is a very aspirational document. It hasn't really, I don't think it's been fully adopted in terms of practice, but I think it's quite consistent with the aims of the World Health Network about ending pandemics. I think the other huge challenge is global equity, because while we have huge inequity in the distribution of vaccines, it means this virus is still going to be circulating very intensely at a global level. And we can see here this giant gap between wealthy and obviously lower middle income countries in Africa. So in summary, I think there's no question that elimination is the optimal response before you have vaccines, which is the case for emerging infectious diseases. We do need more enhanced vaccines and antivirals. I think there's good candidates on the way that will make elimination more feasible and sustainable. We also need to make the case for elimination, which I think will depend very much on data on long COVID and also questions around equity. And we have a critical need for global leadership in this area, which I think this meeting is helping to assist with. And just acknowledging my many collaborators in this area. Thank you.
Hi, sorry, I thought I was talking, but I was talking to the mute. So thank you very much, Michael, for that presentation. Let's now go to Eric Feigl-Ding, who will be talking about variants. Go ahead, and vaccinations.
Can you hear me now? Hi, so I've been asked to give a few opening remarks, and obviously the variants and the vaccines are a global concern right now, because in many ways I want people to think of it this way, that with variants, you basically it's a race in which previously the most infectious are the fastest sprinting varieties, fastest, most infectious. But as more people are infected and as more people are vaccinated, the threat of variants actually becomes greater. Not because we're vaccinating, but just naturally because as the walls are shrinking in, the variant that emerges that is not the fastest, but the best pole vaulter and high jumper is the variant that's going to succeed. And in many ways, have already seen that. There's many variants that are now more distantly mutated than ever before from the original Wuhan. And vaccines work, but vaccines, of course, cannot be enough in isolation, and they have to be multi-layered. I think everyone here agrees with that. But I think what then we need to basically describe it in a more vivid way that the lay policymakers and lay audience can understand. When we talk about, reducing the R, and all that is very, very, technical. What we need to basically say is we need a very high levee, a very high seawall, akin to what, say, Netherlands has in terms of their seawall against flooding, rather than a series of speed bumps or earthen dams that can be easily worn away, easily topped by a surge. And only by creating very high seawall of multiple mitigations plus vaccines before they wane, and hence boosters, can we create this impenetrable wall that will eventually muzzle out and hopefully eliminate the virus. But if we create a series of earthen dams that says, oh, well, it's only hospitalization that matters. Hospitalization protection is great, but infection efficacy, even if it's 40, 50%, that's good enough. That's not good enough, to be honest. And that is the earthen dam rudimentary blockade, in which it can easily be worn away and can easily be crested and topped, and which creates another wave. And I think that we have to think of vaccine and variants in that way, that we want to create a wall that cannot be pole vaulted over, and a wall that's sturdy enough to handle a wave that will crash upon us, with a combination of vaccines plus other mitigations, of course, together. And that is the way to hold back another future wave and stop this endless cycle that we're currently seeing. And of course, vaccine equity is an important part of that. But again, vaccine should not be the sole silver bullet, or else we're going to deal with these continual variants that will try to attempt to basically crest over the wall and pole vault over. And I think we have to think of mitigation and this pandemic control in that way, and look forward to chatting more about it at a later session.
So Eric will be talking a little bit later, as will others of the opening session speakers. Thank you. Gunhild will now be talking about Norway. She's been really confronting the disinformation, misinformation challenges there. Please go ahead.
So can you hear me now?
Yes.
Good. I'll be trying to share my screen and see if that works. So can you see this?
Yes, we can see it. Yes.
Okay, good. I cannot see you, but please give me a heads up if something is going wrong. Right, because I can see my slides. So yes, very briefly about Norway's response. So I'll just start by showing you this slide of the daily new COVID cases per million people in Norway. And that's the lower green curve, and then for comparison, United States. So as you can see, very early in the beginning of the pandemic, there was this bump, and you can see it started really early, but it doesn't look too dramatic. What actually happened was a lot more dramatic, though, and these are model estimates from Imperial College, and you see the columns, the brown columns at the bottom. That's the registered cases, and what really happened was a very, very dramatic exponential rise in cases, and that led to the need of a very early lockdown. Relatively mild measures, no mention of strategies. It was just to stop the catastrophe, more or less, and things were happening as we walked along. The Norwegian Institute of Public Health published a report on the very same day of the lockdown, and they predicted that the pandemic would pass in one large wave, where the number of daily infections would rise until herd immunity by infection set in to stop the pandemic.
Meintest du mich? Nein.
After an estimated 42% of the population had been infected. So as a researcher, I didn't have a role in the handling of the pandemic, but I was extremely troubled by these predictions. So after publishing a couple of op-eds, I was invited to a live TV show in prime time, where I explained and I warned strongly against the idea of herd immunity by infection. And I advised strongly that we adopt instead a strategy of elimination. But people were really unprepared for this. And since the program, I've been heavily marginalized and harassed. So it's been hard, but I recently got some recognition from the Deputy Director General at our Directorate of Health. So that was good. And importantly, a week after that first TV show, Norway did declare that we would follow a stop strategy. And we did that until 7th of May. And as you see from the green curve, the cases did fall dramatically almost to zero. And in that time also you see Norway, these are the deaths, and Norway is really very, very low. So we managed to curb that curve as well. So that was very fortunate, and we got the chance to build up our main defense, which was the test, trace and isolate system that has been very successful in Norway, even stopped several Delta outbreaks. Now we also have the mRNA vaccines. About 70% are fully vaccinated, but it's not really rising much anymore. So the problem in Norway is that since the summer of 2021, the theme has been more along the lines of the pandemic is over, and the Institute of Public Health has been bringing out messages such as COVID can be compared to the flu for those vaccinated, and that COVID is harmless for children. And the Norwegian authorities have been stopping almost all interventions, including masks, scaling down testing, trace and isolate system, and now stopping mass testing in schools. So more or less learning to live with the virus. And the number of daily tests are falling, but the positivity rates are really skyrocketing now. So Norway has now stopped controlling this pandemic and stopped trying to control it. And we see these are the red curve here is the number of hospitalizations, and just these very last days, there is reports of the beginning of chaos in the hospitals for the first time actually during this pandemic. So whereas Norway could have more or less written the book of how to control this pandemic when the virus was in circulation. Instead, they chose to do this, and we'll see how that goes. Yeah, thank you.
Thank you, Gunhild. It was very impressive recently that you were recognized for the early work that you did. Let me now turn to Luis Eugenio, who will talk about South America. Please go ahead. Would you stop your screen sharing? Thank you. Go ahead, Luis.
Thank you, Yanir. Thank you all. First of all, in the name of the World Federation of Public Health Associations, I'd like to congratulate the World Health Network for organizing this important summit. I will share my screen with some numbers from Latin America and South America, specifically countries. It's coming. Oh, I don't. Oh, so let me tell. South America has been hardly hit by the COVID pandemic. Indeed, while the world has accumulated 31,000 confirmed cases per million people, South America has 88,000 cases per million, almost 3 times more. In terms of deaths, while the world accumulated 635 deaths per million, South America has 2,695 deaths per million, 4 times more. The fatality rate is 50% higher in South America than in the world. In sum, the region accounts for about 20% of confirmed cases and about 30% of deaths worldwide, despite having only 8.4% of the world's population. In 2020, as a result of the health crisis, South America experienced the largest economic contraction in the last 120 years, and was the region that had the worst performance of all developing regions. In the same year, poverty added 22 million people compared to 2019, reaching 1/3 of the total population. South America is characterized by presenting structural conditions of inequity, vulnerability, and social exclusion that are combined with the precariousness of employment and the weakness of social protection systems. These conditions are reflected in the structure of the health systems that are underfunded, segmented, and fragmented. How did the region respond to the pandemic? Countries had to make great efforts to respond in time to the clinical needs of COVID-19, considering the shortage of hospital beds in the health system of the region. The region was able to increase the capacity of hospital care and in particular in intensive care. However, this increase has been uneven among different countries. Public health measures to contain the spread of the virus have focused mainly on quarantine policies, also with diverse results in different countries. In terms of vaccination coverage, heterogeneity has been the main feature from the regions, with some countries doing well, but most of them doing poorly. In general, the main problem is the lack of doses. Despite not having completely avoided the worsening of the social situation, some governmental actions have been able to mitigate the setbacks in terms of economic development. In this scenario, South American countries need urgently to accelerate the massive vaccination process and formulate strategies aimed at strengthening local systems for the production of essential drugs and vaccines. 2, to transform their health systems, having on account the centrality of primary health care, the financial sustainability, and health equity. To incorporate the intersectoral approach in health policies. To strengthen regional integration, international collaboration under a new democratic multilateral systems. To consolidate welfare states and universal redistributive and solidarity policies based on human rights. To promote the sustainable development, which requires overcoming the financialized economy in line with solidarity economy. With the measures, not only will the COVID-19 pandemic come to an end, but a new era of social development and improved quality of life may begin. Thank you very much.
Thank you, Luis, and thank you also for the welcoming by the World Association of Public Health Associations. Thank you very much for that remark. I would like to turn to Mayor Rubin now, who will talk about the challenges of upcoming crises. Thank you.
Thank you very much, Anil. Thank you, everybody. So we know that the situation now is pretty weird in some way. First of all, in a new pandemic, we have a vaccine so fast that is so extremely effective, over 90% effectiveness. But on the other hand, we managed to actually infect a lot of animals. It's pretty incredible. I tried to research for it, but it's well maybe the first time in the history of the world that a pandemic in animals started from humans. We infected deer, we infected dogs, cats, many other animals, and it's just a matter of time until a wild animal will be actually able to infect humans back. So this is one problem, and because we have no control over animal population in the wild. For example, the white-tailed deer in the US, some populations already 80% are seropositive, and I promise you, they got infected in open air. Now, and if the virus is circulating in this population, it will change. And it will return to us at some point, maybe, or create another long-term damages. This is one danger. Second danger is people that are immune compromised. In the US, for example, about 3% of the population is immune compromised at some level. Medically immune compromised, considered to be immune compromised. But in Africa, in the continent, some countries have 10, 20, or 30% of the population HIV positive. These are people that, in many cases, their immune system is not existent. Now we know for sure now that immune compromised people that are infected with SARS-CoV may actually be carriers for over half a year. They may create variants of their own. We know we already seen papers where the researchers mapped the whole process. Through the process of the variant creation in an immune-compromised person, there was a research in a Russian paper, an American paper, and they took samples from the person every few days, and they did a whole genome sequence on the samples, and they found out like there was a person, one woman who actually created a version of Delta before Delta appeared in the real world. We only find it later, but the samples were taken before Delta were circulating. So the continent of Africa and other countries where the health system is failing, they will most probably create new variants that may make a lot of damage. So just one example, the 8.30 variant, it's probably originated from Tanzania or Congo. We only find 5 samples in the whole world in genome sequence because Delta did us a favor, and it's so infectious that other variants, even very bad ones, are not able to circulate. But 830 is worse than any other variant in terms of hurting the effectiveness of vaccines and also of people that already recovered. When we see that the risk of big populations creating variants is serious, either humans or animals, we need to create methods that are effective enough to allow us to live our life together without taking extreme measures, even with a serious outbreak of new variants that can override vaccines or create other damages. And it means that we need to have, first of all, as a legal basis, just like in Taiwan, they have a very good pandemics law, setting responsibilities, giving authorities who controls the borders, who is activating the system and calling an emergency on a national level, not only on the international level. We see that you can't trust the World Health Organization to actually call a pandemic on time. We just seen it in the real world; it's not working. So every nation needs to take care of itself, and therefore helps the whole world. It's like a person getting vaccinated. A nation getting vaccinated is like less danger to the whole world. So if you see like a nation like the UK, which do not handle itself, risking everybody else, a nation like Portugal that vaccinated everybody, even after the gut of like a very serious blow in the first few waves, like a huge percentage of the population that died, but now they took care of it and they are not posing a risk to others. So we need to create many layers. First of all, we need HEPA filters in all classrooms. Just like we anticipate that every public building will have a restroom and clean running water and some other civilized technologies, every room in a public space need to have HEPA filters. That's a minimum now. We want to protect our kids. And on the way, we may eliminate other nasty viruses like RSV in seasonal flu. We have seen we already probably eradicated one of the 4 main seasonal flu viruses. So just by mistake, it just happened. So first of all, HEPA filters. Second of all, we need to be able to control borders. We need to create an international agreement, how you control borders, how you call it, who can do it, how you do it in levels. Just like countries pretty much moved between closing everything to not closing anything and some in between. But there is no like an international accepted level that you call it, this is green, I'm green, I'm yellow, I'm red, and everybody else understand what you are doing, and everybody agree, and you know how you pay pay for people that their flights were canceled and everything else. We need to set this, and also we need to accelerate the process of creating a pan-coronavirus vaccine. It's already under work for many years now. We need to accelerate this because a pan-coronavirus vaccine will most probably be variants resistant, and then that people trust in the vaccine, we move on. And once we have it, we will get rid of MERS, we will get rid of coronavirus, we will get rid of a few nasty seasonal colds that do not kill people, but we lose a lot of the working days and a lot of health and over them. And we will also gain the public trust that once you are vaccinated, you are protected. And this is a major point, especially in the third world, where people do not know if they will have access to boosters or to future vaccines. So all of this, it requires like a constant pressure on decision makers that the best day to actually do something about keeping our kids safe and keeping our nation safe is today, because yesterday already passed and tomorrow may be too late. We need to do everything we are able to do today. And if we are able to vaccinate 12 to 15 years old, we need to vaccinate them today. If we are able to vaccinate 5 to 11 years old, we need to do it today, not to wait for the next surprise from the virus, but we need to be ahead of the virus. And maybe if we will do it, in a timely manner and on a national, on a global contradicted response, maybe we will be able to stop the next pandemic on spot. And just like Nassim Nicholas Taleb said on the first part of this conference, we will not punish the next politicians that will be able to actually stop a pandemic before it's starting to be serious. Maybe if enough people will understand the process, we will be able to give him credit for that, and this way prevent the next ones. Thank you very much.
Thank you, Mayor. That's a very helpful perspective. And let's now go to Matthias. We're running a bit late, but we'll be okay. So we don't have to rush too much, but please, Matthias, go ahead. You will tell us about the academic institutions and how they've been able to bridge to decision makers. Thank you.
Yes, thank you, Yanir. Thank you very much. Can you hear me okay? I have no slides. Okay, so, Germany is not doing good either. So let's get this out of the way so we can talk about something different. Because I want to talk, as you said, less of why we are here, but more on how to deal with it now. Because I think we all agree, and I think already these few statements have been very clear. The science is obvious and clear to us. Elimination and vaccinations are the cornerstones. If there are not sufficient vaccines available, or if the vaccine by itself are not sufficient to control the pandemic, you apply or supplement with a combination of tools, the classical tools like contact reduction and isolation, as well as modern tools like tests and tracing systems, ventilation, high quality masks, and so on. We have heard it all. I just want to briefly summarize to get to the point. But if the science is so clear, and we have heard it already today in a variety of talks, and many will follow today and tomorrow, that all come to the same conclusions, that the elimination strategy is the best for everybody. If the science is so clear, how come that countries take such different approaches, especially when you compare the Asian Pacific countries with the European countries and the US? I mean, if you all know, if a physician in Australia plans a medical procedure, we expect he or she follows the same literature, protocols as his colleagues in the United States. And similar, an engineer in New Zealand encounters a technological challenge, she follows the same scientific principles as the colleagues in Europe. I leave the analysis of state stability as a possible cause for this paradox between pandemic conditions and regular conditions to the psychologists and the politicians, or the political scientists. But I assume at least one thing is a clear difference between a medical procedure, an engineer, and a pandemic. It is that this is not just a problem, but we have a full-blown crisis at hand, which shakes the pillars of a society and creates a degree of disorientation that we are facing. I think the past 18 months have shown this, at least in Germany, very clearly. Either way, just like Noam Chomsky said, there's only one known successful strategy to respond to an urgent crisis: when leadership fails. And in many of our countries, and that what has brought us together, this is the case. You need an informed and/or a scientific guided community that demonstrates engagement. This may eventually compel the decision makers, or hopefully compel the decision makers to act. So I'm happy to say that this, of course, is exactly one of the key motivations of the World Health Networks, offering ideas and opportunities for science guiding community action. And Jörg Danzer from End Corona in Germany, which played a very important role for me during the entire pandemic, will actually elaborate on such community actions in his next presentations. But let me close with one example on the important and very much underestimated role of academic institutions in this process to deal with crisis. I believe the university campus is one of the best inventions of the human mankind. You already have the scientists there, which can answer the questions and give science-based guidance, but you have so much more. And particularly, We have a community that wants to be informed and is ready to engage. And quite importantly, the university has a high degree of independency, for the simple fact that independency is at the very core of all science. The president of the Technical University in Dortmund, for instance, a physicist, accepted the science and acted accordingly when large parts of the political institutions, as well as parts of the society, were in a state of disorientation or even confusion. The positive model at the university not only worked and led to a green zone on our campus, with no community transmission since about 8 months now, it also inspired the city. One symptom of inspiration is the fact that just now, where large parts of Germany are in a frenzy to drop all restrictions despite very high infection rates and death, the city of Dortmund decided the opposite and expanded their testing strategies in daycare centers massively. And the university, they implemented a research study offering fast PCR tests 4 times a week. It not only encourages all students and members of the university, including those vaccinated, to go get tested, but it invites also their family members or partners to take part in the study for free. So let me come to an end and summarize my main point. The community action is the key for changes during a crisis at the and the university has an incredible potential to be the jump starter for the process. The knowledge, the science, and the thousands of young students willing to engage and work for a better world are already connected. The network which is already there, and it represents a great source of resilience in such times. If they are mobilized and go out there to inform the general public, leading to more mobilization and more active groups in a self-propelling process, decision makers will eventually feel compelled to act. This applies, of course, to any crisis, I believe, including the one about the climate. Thanks for not giving up.
Thank you, Matthias. And I think what you said is extremely important. And Dana had said something about in the US, the universities are syncing with policymakers, but there's actually a wide range of different responses that have occurred also in the US. And I think that recognizing that any local example of achieving elimination and of confronting this disease does serve as a model, because there are, of course, other people that are connected to it and will learn from it and take it as an example. Let's now go ahead to Jörg, who is going to elaborate on the actions in Germany. Go ahead, Jörg.
Thank you so much for having me. My name is Jörg Danis and I live in South Bavaria.
I think you're muted, Jörg.
Jörg, please unmute.
Let me email Michelle, as I am not in, but Michelle.
I'm sorry. As an activist, I'm engaged for End Corona Jetzt, standing for End Corona Crisis Now.
His connection is not the best, I guess. Let me just check. And Nicole, you are next.
Can you hear me?
Yeah, now I can hear you. Go ahead, Jörg.
Okay. The story started in summer 2020 as different initiatives formed and campaigned for safe schools and nurseries, such as Sichere Bildung jetzt and Bildung aber sicher. Groups formed for safe circles mit Abstand glücklich and family with high-risk children, as well as groups who promoted rapid tests. Many of the groups were connected to endcoronavirus.org and used the Slack workspace. Thanks, Yania, for that. Activities, for example, were online demonstrations on Twitter, like the Zero Action Day each Sunday, but also writing letters to politicians and majors as well. The support of the publication of the first initiative for a pan-European containment strategy from Viola Briesemann, published in The Lancet, and which was used for the petition of Zero COVID going for a solidary lockdown in Europe. Between Christmas 2020 and New Year 2021, Wellenbrecher Jetzt produced 2 interviews with Matthias, with you, Yanir, how the crisis can be managed, and the other with Stephen Duckett from Australia on how the crisis has been managed already. The interviews were distributed on social media, and out of that, the German no-COVID scientist group formed with physicists and modelists, virologists, ethics, economy, and public health. The no-COVID scientist group addressed directly to the German government as well as German media. Parallel to that, different regional no-COVID support groups formed in Berlin, Bavaria, Saxony, Algovia, Franconia, and cities of Münster and Nuremberg. 18 of these community action groups gathered within the Action Alliance. Grüne Zonen means green zones. Several demonstrations on Twitter and in real life were performed, such as Einkerzen and Leben retten. The pandemic management as well as a no-COVID strategy was neglected with the start of the election campaign in Germany mid-end of May. In the summer 2021, new initiatives formed with the same people, but under other names, avoiding the trademark no COVID. For example, Luftfilter jetzt means air purifiers now and protect the kids. The campaign running right now, called Team Kinderschutz, is spreading the letter of Anthony Leonardi, pointing out to long COVID and other risks of for kids. The main hindrances in Germany are the yellow press, the Bild-Zeitung, and misinformation campaigns like Querdenken and ex-anti-vaxxers, as well as lobby groups like Familien in der Krise or Initiative Familien. The main problem in Germany seems to be the lack of guidance, competence of the government. The politicians listen to what we say, but then they go the path of the apparently least resistance. Altogether, about 500 people are engaged in community action groups in Germany with growing support. We are just right now facing the growth of the fourth wave of infections, and measures are too late again in Germany. However, community action groups will go on and are quite good organized. Please join our session for the new strategy tomorrow at 12 p.m. Eastern Time. Thanks to the end-corona team and the no-COVID team and all scientists and activists in Germany and worldwide. Thank you so much.
Thank you. We switched you to audio only because of your connection, but for those of you who would like to hear more, there is an entire long session tomorrow on the situation in Germany with Matthias and many other speakers who have played a significant role in the efforts there. Now, Nicole, you're next to talk about the situation in Michigan. Is Jennifer joining you, or are you going to be talking?
Jennifer is actually going to be the one talking. She's up in the top row.
Okay, so I need to pull her down just a moment. I didn't have instructions about this, so let me move you then to the next row, or someone has already moved me. There's Jennifer, all set. Please go ahead, Jennifer.
Hi, my name is Jennifer Tuxell. Nicole Kessler and myself are advocate leaders with Michigan Parent Alliance for Safe Schools. And we will be the moderators for a session tonight at 7 p.m. Eastern. It is titled Widespread Intimidation of Elected Officials, Superintendents and Parents Who Support COVID Mitigation, An American Dilemma. Michigan Parent Alliance for Safe Schools is a coalition of county-level pro-COVID mitigation group leaders from across the state. We are about 10,000 members strong across all of our groups. The session's focus is on the intimidation and harassment that is widespread across the United States. Public health officials, elected officials, school board members, superintendents of school districts, and parents advocating for COVID mitigation commonly face harassment and intimidation from anti-mask, anti-vaccine community members, and even from other elected officials who are openly anti-COVID mitigation. Our panelists tonight are Norm Hess, the Executive Director for the Michigan Association for Local Public Health, Lori Freeman, the CEO of the National Association of County and City Health Officials, Linda Vale, Health Officer, Ingham County Health Department Administration, Dr. Beth Resnick, Assistant Dean for Public Health Practice, Director in Public Health Policy, Johns Hopkins Bloomberg School of Public Health, and Eric Scorzoni, the Center for Local Government Finance and Policy, Michigan State University. They will detail the threats and intimidation they and their colleagues have faced and the negative impact it has had on implementing COVID mitigation strategies. Following the discussion, we will be having a question and answer period with them. So that's it.
Thank you very much. And the session is important. And I would like to now shift again to Susan to talk about the conditions. This is Susan BloombergCason to talk about the conditions in Chicago. Please, Susan. You can unmute. Susan, can you hear me? There.
I can't hear anything.
Can you hear me? We can hear you. I can hear you.
I don't have any audio.
You can
Should I
go
just
ahead.
speak? Because
Talk.
I can't hear anything. So, okay.
Yeah, speak.
If you can hear me, my name is Susan BloombergCason. I'm a parent advocate outside of Chicago. And 2 of my kids are in middle school and high school, but I do have a 23-year-old son who is a teacher in Taiwan. And, but for the Chicago situation, things are not bad. Chicago and my state of Illinois, we do have good news that our governor has by and large taken the pandemic seriously. He reinstated a mask mandate for schools in mid-August, just as schools are going back fully in person for the first time in 18 months. Then the state took action in August when a private school near me announced they were not going to abide by the mask mandate. The state threatened to prohibit students at that school from participating in sports and other extracurriculars and not allowing the high school seniors to graduate with a recognized degree from that state. So the principal, in a face-saving measure, took a day or two to meet with the administration and came back to announce that they indeed were going to follow the mask mandate after they did their so-called own research. So it seemed reassuring that the state would not take it lightly if schools did not follow this mask mandate. Something else happened at the end of August. After some of the schools had started, the governor announced on August 30th that he would have a mask mandate for every indoor space in the state. So this measure further reinforced the importance of masking. For the city of Chicago, the indoor mask mandate is being taken pretty seriously, and I've noted that about half the people outside are wearing masks. So this shows a culture of masking and caring about public health. But in the suburbs and rural parts of the state, it's very unusual to see people masked outside. So since these 2 mandates were declared, our numbers have fallen. In August, we saw a daily average case that ranged from 3,000 to 4,000 a day. And for all of October, new cases range from about 2,500 to 2,000 a day. Hospitalizations, which of course are only, just don't indicate the seriousness of COVID, fell from the early summer daily hospitalization rate of 400 a night. But they rose in July and August, they were 2,200 a night. Now it's about 1,300 a night. But it seems as if we are Cinderella at the ball and the clock is about to strike midnight. The governor has made some vague comments about lifting the indoor mask mandate before the holidays if the numbers go down. Every county in Illinois has a high or substantial transmission rate, apart from 2 small counties that have a moderate transmission rate, but no county has a low transmission rate. Right now, 70% of 12 and above are vaccinated in Illinois. So it's worrisome that the indoor mask mandate may be lifted before the 2 youngest age groups are vaccinated, and that we're going into our cold season and people will be spending, cold temperature season, and people will be spending more time indoors. And what's also troubling is that there are a lot of organized parents groups that are fighting the school mask mandate. One of these groups sells yard signs that say, "Follow the science, unmask the kids." Others are pooling funds to sue the state over the school mask mandate. There's a worry that if the governor lifts the indoor mask mandate and keeps the school mandate, some parents are going to use the former to justify disregarding the latter. I'm also worried that people here are content with 2,000 cases a day. In mid-June, for about 2 weeks, we were down to 180 to 200 cases a day. And that's when the governor lifted the previous mask mandates. So now we have 10 times those cases and winter is approaching. And that's where we are in Chicago.
Thanks, Susan, for telling us the situation there. And obviously, we are hoping that you'll be able to change things in a strong way. And we'll be talking about a number of different approaches to the challenges for community action. The next speaker, Stefan, will be talking about one of the programs that we have to help out. Go ahead, Stefan.
Thank you for the introduction, Yanir. So I'm pleased to be here from Canada to talk about how we can respond to some of the challenges, as you just said, related to the airborne nature of the transmission, but more specifically about DIY airborne precautions. So I will focus on practical solutions for school or for workplaces, such as air cleaners, ventilation, etc. First, why do we need to improve ventilation or filtration? It is essentially to efficiently reduce the risks of exposure to aerosols with potentially viral loads indeed. So the key here is to think of it as a risk management tool. Indeed, the level of risks is different, are different depending on the settings. So workplaces and especially school with aggregated and confined people are typically high-risk settings. In the hierarchy of controls, which is well known in the health and safety world, engineering controls, that includes ventilation, filtration, and so forth, are known to be quite effective to help minimize the risks. So how can they reduce these risks while there is a lack of other measures in some places? For example, no mask mandate, no remote working or online learning. So it's essentially by reducing the amount of contaminant in the air. Here, the contaminant is the aerosols, are in fact the aerosols. So the role of ventilation or filtration is to dilute or capture these aerosols. So I will not reiterate that aerosols are the main, if not the dominant transmission mechanism. I think I would preach to the choir here. But rather, I will talk about the fact that the resistance to recognize the airborne nature of the transmission has delayed the focus on effective solutions. For an engineer like me, having done its PhD in ventilation systems a couple of decades ago, it was clear that it makes no sense when officials, especially PH officers, would be saying that ventilation or filtration could pose a risk. So, and they don't recommend it. It's like reversing the precautionary principle. In fact, it's not making sense. So with just a risk mitigation 101 course or a risk mitigation for dummy book, we would be quickly arriving to the conclusion that these simple precautions would help much more than any risk they could cause. This is essentially what many organizations and scientists have said in the last year, such as the UK Chartered Institution of Building Services Engineers, the RIVA in Europe, also the ASHRAE in the United States, and even the WHO has said that as well. Some mechanisms are identified as simple and effective in reducing exposition to the risks. So air exchange, so dilution with outside air, opening windows, for example, or having proper ventilation, avoiding recirculation of stale air, etc. So first, and second, filtration, proper filtration with the capacity to capture smaller particles. So air filters or purifiers with HEPA filters or MERV 13 or better filters, with or without UV apparatus, but surely without all the other features, such as ionizers, ozone generators, generation stuff. In fact, they add nothing, and they cost money. So they take money out of the capacity to pay from school boards, for example, which have not much more than what they have, they need to have. And also they generate other byproducts, chemicals that we don't want to see in our hair. So a simple, good coupling of proper filters and fans can reduce the amount of virus by capturing the aerosols. The CDC and the EPA and many others have recommended them really early, if not early, but months ago already. Nevertheless, you might still find just a few local authorities around the world that will recommend them clearly. So that's why we need some do-it-yourself solution. And that's why at the World Health Network, we have the WHN Indoor Air Quality Group and its DIY Air Cleaner Task Force. So the idea is now that we start to have a bigger portion of the population, of the people, understanding that virus glides in these small aerosols in the air, the micro droplets, aerosols. So we cannot let the people down and just let them wait for their government, their authorities to decide to do something. They can protect themselves with do-it-yourself system. So we need to help them organize. We need to help them prepare airborne precaution properly done for their homes, for their school, for their workplace. And it can be also to find or identify good practices to put in place. It can also be to add just proper measure in the already measure which are already in place, even filtration, changing for proper filtration. But you can also build your the new systems, make your air cleaners with good filters. And that's what's effective in the engineering controls I was talking about. So indeed, you can use in the United States, you can use we have really good examples like the famous Corsi Rosenthal box, an awesome design, an initiative of these two well-known fathers, I would say, great initiative. But in some areas, in some countries, some parts, some components, essential components might be difficult to find or to source. Some components might not be certified for local use as well. So that's why we started this task force last summer, a group of experts in many fields, from applied and pure science to communication and manufacturing, from healthcare, schools, workplaces, to parents and unions, and that look into these DIY solutions for those places where the standard version, the CR box cannot be applied. We've also worked on a safe school checklist. By checking off all the practices, precaution in your school or daycare center, you can definitely identify those who are not there and that should be there. And some of them are really easy to implement. Others might need some professionals to be involved, but at least you can identify what's there and what's missing. And the third version of this checklist will be released during the summit. So in short, I'm really pleased, and I should say honored, to be coordinating the team, the indoor air quality team at the WHN, and that will be part of the discussion in a session in just 45 minutes from now, talking about these DIY solutions in details at 4 p.m. Eastern New York time. And also I will be co-chairing another session on collaboration. So not working with a siloed approach, but interdisciplinary with people coming from different walks of life, different backgrounds. So you're all invited, and thank you very much for the time.
Thank you, Stéphane. It's amazing work that they've been doing and really creating opportunities around the world to create DIY help for local challenges. We have a video. Elisa Bastiani wasn't able to come today. Erica, would you be able to share your screen and show the video about the community actions in France? Did something happen? Are we? Erica, it came up and then disappeared. Are we? So I don't know if there are some technical issues. So we are going to be shifting to talking about some of the central activities at the World Health Network. And we'll start this off with Greta talking about the COVID Action Group. Please go ahead, Greta.
Thank you, Yanir. I am honored to be speaking about the COVID Action Group, and I'm privileged to have the opportunity to be a part of this initiative. In the fall of 2020, In response to the ongoing worldwide crisis caused by the COVID-19 pandemic, we founded the COVID Action Group, a multidisciplinary network of experts in pandemics and related fields, united with citizens groups. Our mission is to serve as a people's task force to advise policymakers and empower communities with practical strategies to progressively eliminate COVID-19, identifying and filling in the gaps left by the responses of governments and existing agencies. We are motivated by compassion and guided by science. Our objectives are to protect and preserve health and well-being, lives and livelihoods, and to restore the economy without exacting an unnecessary and terrible human toll. We provide scientific guidance and support for community efforts, linking scientists and communities to debunk life-threatening disinformation and to provide clarity in the midst of confusion. We build trust by speaking the truth. We oppose those who diminish the value of life, who sacrifice our loved ones through lack of caring for the well-being of others, exploit others for their own benefit, and misinform whether intentionally or out of confusion. We oppose faulty science, faulty assumptions, false claims, and wishful thinking. Over the past year, our science team has researched, written, and compiled a wide range of resources, providing the tools that individuals and communities can use in order to make the best choices to keep themselves and their families and communities safe. Our members have guided successful elimination efforts in multiple countries, advised governments and institutions, built accessible data analytic platforms, illustrated the primarily airborne nature of viral transmission, and advocated for airborne precautions and school safety, produced scientific consensus documents, engaged in public communication, and in community-based efforts to promote individual and public health, and provided evidence that elimination is a cost-effective economic investment and there is no trade-off between health and the economy. As we expanded nationally here in the US, we also began to expand globally, recognizing that collaboration between countries is essential for an effective pandemic response. We formed the World Health Network, uniting organizations from around the world with the COVID Action Group serving as its scientific core. Through the WHN platform, we are providing a framework for the sharing of knowledge and resources, enabling comparisons of policies across the globe in order to learn which initiatives are effective and to learn from those which are not. We are bringing citizens groups together, facilitating the coordination and pooling of resources of their parallel and previously solo efforts to overcome disinformation and to take science-informed actions to prevent transmission and to provide community care and support. Our publications will be made available to the public, covering topics such as airborne transmission, advantages of achieving progressive elimination and the methods used by the countries which have been successful, guidance on safer lifestyle choices, economic and scientific analyses, as well as updates, policy statements, and responses to current conditions worldwide, including the collaborative efforts across countries as we develop and advise on national and global strategies and their implementation. An all-hands-on-deck approach is needed to progressively eliminate COVID-19, and we are expanding our membership. So if you haven't already done so, please join us and learn how you can get involved. Together, we can stop the virus and build a safer and better future. Thank you.
Thank you, Greta, who's been a core member of the COVID Action Group since last year, I guess about a year now. And I want to hand now to Carlos, who's going to be talking about a new a platform that the World Health Network, in particular the COVID Action Group, is developing. Please, Carlos, would you talk about the WHM communications? Thank you.
Yes, thank you, Janir. So, starting with the COVID Action Group, we began publishing short pieces trying to inform the public of different situations. For example, the why it was a bad decision of the CDC to remove the mask mandates last spring, and several others. And as we were publishing it, well, among ourselves, we were peer reviewing and commenting and let's say giving them diffusion, spreading the word about these pieces. So the idea are also of having a journal, a digital journal, where we can, in a more formal way, publish not only short pieces, but also reviews, videos, infographics, and exploring different alternatives. We decided to build our own. So we're about to launch the WHN Communications. And we have a session at 6 p.m. Eastern time. And there we'll give a bit more details about the project, what we have been doing and what we plan to do. And the participants will be Alex Milne, Gunhild Newberg, Blake Elias, Greta Fox, and Janir and I will also be there. So be sure to join us. And the main goal of the WHN Communications is to try to inform the public from an authoritative location, so that let's say people and media know that, let's say, the information we are sharing is the rigorous, and let's say we will also be aiming at giving trying to limit bad advices that either media or governments might give to their citizens.
Thank you very much, Carlos. That's helpful. So that we'll talk about that more later today in the program. And now let me turn it over to Krzysztof. Krzysztof is the chair of the ethics panel of the World Health Network. Please, Krzysztof, tell us about your efforts.
Yeah. Hi. Hello, everybody. So I will share my screen. Can you see it? I hope you do. So we have an ethics panel, and what is it? And why do we need one? Well, we need one in principle, because ethics panel gives clarity for ourselves and for others. Ethics regulation is needed also for organizations with ethical members, and setting up ethical frameworks to avoid conflicts or address them is essential. It's also good to establish ethical culture, and also for specific tasks such as review of our ethical framework and conflict resolution. Two things that we really planned this ethics panel for. So what have we done so far? Headhunting for panel members, which is ongoing, and we welcome your interest. Drafting of principles, which are based on the values statement that was already read during the last summit. We drafted the code of conduct, which I will speed read during the next slide, and then the conflict resolution process. We designed it and we described it so that it is clear how to resolve conflicts, what to do if issues arise. So, code of conduct. Let me read it. This is our code of conduct. Individual and group members of WHN are expected to abide by the values and ethical principles on which WHN was founded and under which it operates. Scientific position statements require evidence. CAG, COVID Action Group, is the science arm of WHN and should be part of any conversation about scientific statements. The goal and values of WHN include the value for human life, livelihood and safety, including elimination of COVID. There will be differences and disagreements on the best ways to achieve this globally, nationally and regionally. Disagreements will be expressed respectfully and with openness to other opinions and strategies, and the knowledge that there is more than one right way to achieve a goal. Social media are very powerful ways to express goals, strategies and ideas to many people quickly to galvanize support and action. Social media can also be damaging to individual, group and WHN's reputation and credibility. Once something is out on social media, it cannot be taken back. Public attacks, therefore, on groups and individuals are not acceptable. We do not tolerate confrontation within the network. We are working against COVID. There may be disagreements of opinion about details or strategies, but an attack of one group on another is counterproductive, and we will have to exclude any individuals or groups that are attacking or undermining the effort of others. Where groups have had conflict before, they must affirm that they will follow these rules in future interactions. We will join together on the common goal to save lives and health. Personal communications between and among members is assumed to be confidential and not to be shared on social media unless stated otherwise by the center. When in doubt, ask. Members of WHN work together on projects to promote its mission across the globe. Sharing ideas, data, information, and successes is crucial to achieving this. Credit originators and contributors to programs and ideas in any publications and reports. Keep one another informed on updates, new efforts, changes to programs in different areas, and conditions during domain, project, and daily update meetings. So this is our code of conduct. Panel members, for now, Anthony Staines, Yanni, and myself as the chair. And quickly, how does it work? How can we use it? How to raise ethical issue? The best way is the mailbox of Kimberly, Kimberly JM at World Health Network Global. Put ethics in email lead so we know it will go to the ethics panel members. So if issue is raised, team is gathered from the people available to investigate the issue. They come up with some suggested resolution, put it in front of the ethics panel, which recommends a decision, but the decision is taken by the governing body of the WHN, and then the action is taken. So pretty simple, pretty straightforward. Thank you very much for listening, and I will stop sharing my screen now.
Thank you, Krzysztof, for the hard work on developing this. And what I would like to do now, we still have the video. Is Justin in the room? I don't know if he's here. Let's show the video now. And if Justin doesn't come, then I will tell you what he was supposed to mention. But Erica, would you be able to share the video on the effort in France?
Research engineer from France, and I'm... Hi, my name is Elisa Zeno. I'm research engineer from France, and I'm co-founder of École et Famille Oubliées group, a parent group working for safer school in the pandemic context and beyond. So we founded this group because as parents and citizens, we were very concerned by the lack of mitigation measures when school reopened. And figures concerning children clearly show it. It's important to stress that most of deaths and even a major part of hospitalization occurred after the Delta variant. So our objective is to attain a safer education for our children with guidelines based on science, on facts, in order to protect their right to health and the right of the education, of course. For reaching that objective, we attempt to battle against misinformation spread not only by some media, some social networks, or very organized groups with no mask, no vaccine, but also sometimes by health and education authorities, included French Society of Pediatrics, who still continues to say that children are not concerned by the pandemic. And there is a strong long COVID denial. Another point is that schools are safe. There is nothing happening in schools, and they do not play any role in pandemic in their point of view. And that's the reason for which for them mitigation measures are not necessary, and they are even harmful because they impact children's mental health. There is a last very recent point is that it's better for children to get COVID-19 now for stimulating immunity on the principle of box parties in the past. So we try to battle against that misinformation, to inform parents, teachers, and also to exchange with public health and policymakers in order to share and propose the solutions based on science through an extensive literature review, a press survey, the following up of the epidemic data for children, because there is a lack of transparency. And we propose the school guidelines, some practical tools, some stories to show what it is, what can be sometimes to have a child with COVID. And different actions were done by writing to the government, to the parliaments, the elected officials and scientists, organizing campaigns on social networks and writing opinion articles. And all that by building a network in cooperation with groups of scientists, of teachers, of parents, and of patients too. Because we really think that children protection should be a priority, and it's really a moral imperative and a legal obligation for parents and for governments.
Thank you very much. Can you close the video, Erica, please? And now this session is coming to an end. Let me just say, I don't see that Justin is here, but Justin was supposed to announce that there is a leadership training program. Erica, can you stop the sharing, please, if you can? I don't have a way of let's do this. Okay. All right. So, there is going to be a leadership training program starting at 8 this evening. It will be 2 hours long and run in parallel with other sessions. It will be in the public hall here or close by, so to speak, in an adjacent room. So people are welcome to participate in that. There has been a separate registration. We have over 100 people who have registered for this leadership training program. We're very excited to be able to offer it as part of the summit. Thank you very much. Erica, can you hear me? Can you stop sharing your screen, please? Let's see if I can. Can you stop sharing your screen, please? There. Thank you. So now we are now at the end of the opening session. There is about 20 minutes where people can go to network and to explore the space. The easiest way is to go back to main hall. If anybody has trouble getting around, there were some issues with the registration process in the space. If anybody has any trouble navigating, please let us know. Go back to the entryway and we will add the registered tag to your ID here so that you can go around the space. Anybody has trouble navigating, please go back to the entryway. But in the meantime, everybody else, you can go to the main hall, and then from there you can go to the lounge. You can go to the share hall, which is where most of the sessions will be held. There are 3 share rooms that will be used for the sessions and another couple where you can hang out as well. But if you go there, you'll have the program. If you have the program book, you can look at the program book. Anybody who has any questions, you can find the organizers in the entryway to answer any questions that you have. So again, please enjoy the next 20 minutes, take a few minutes to explore the space, and then the sessions will officially begin at 4 p.m. Eastern Time in Share Hall. Thank you very much. I think this session has been incredible, and I'm looking forward to the rest of the meeting. Enjoy.